Hello guys, we are at university. We are with Krishna sir, right?
Yeah,
Yeah.
Dr. Krishna.
So
Yeah.
Dr. Krishna, and the thing is that he is the pediatrician surgeon, and he's been teaching the pharmacology and physiology to the first and second year, I think, and from third year he's teaching the pediatrics. So sir, if you can tell me that how, mostly our students are from South India and they want to know that how is the study pattern. Already we have discussed, like Ravi sir told us, but from your point of view, how the student, how the syllabus and curriculum we are having in the university.
Thank you, ma'am. Actually, we have a lot of experience in this field. We have spent almost more than 20 years in this field. So we have made curriculum like that. We have combined the Indian curriculum, the curriculum which is followed in South Asian countries like Nepal, Pakistan, Bangladesh,
India.
Mainly in India, mainly from AIMS, ma'am. We have taken the syllabus from the AIMS and we have revised it. And we have made according to this university. It is excellent for the Indian students. We have already taught one batch of the Indian student here. They are in second year now. They're extremely happy. And when they solve those FMG questions, they're very happy. And they say almost 80 to 90% of the question we can solve from the first year teaching.
Confidence.
Exactly.
They get confidence.
I'm confidently can say one thing, that the syllabus is excellent according to the requirement of our Indian students.
Yes, but as we discussed that only I think in Asia International this university we have Indian faculty and Nepal faculty, right? So it means that once the students are coming from India, they are a little bit underconfident.
Yeah.
You see.
Yeah.
So it is what do you tell about them? Like if they're underconfident, you make them comfortable and then talk to them or answer, let them make them comfortable and take the question answer Viva or.
Of course, ma'am. So when they come, of course, first we take their classes in a easy way. For example, if a student is not getting it, we can revise those things during our practical classes. And then some students, they don't understand English also. Some students are poor in English, So we can explain later on after the class in their own language as well. Yes. For South Indian students, it is a little bit of problem.
Yeah.
But for Hindi speaking students,
it's not a problem.
It's not a problem, ma'am.
But the thing is that if they are from South India, like from Tamil Nadu or from Kerala or from, you can break them and make them understand the process.
Of course. Actually, all of them can speak English, ma'am.
Yes.
The South Indian students' English is good.
Very good. Yes.
So we don't have that type of problem till now.
With South Indian students.
Yeah, they cannot understand. So we make them understand after explaining again.
Yes, breaking it down, and you can. Okay. So this is one comfortable part of this university, is that if you are not understanding, you don't have to, you are not getting scared or with the teachers.
No need, ma'am. Then we take their Viva time and again, and we make sure that they understand the topic before we move further. So everybody is feeling very confident after coming here.
So they make pure doctors, not to pass.
Exactly.
Real doctors, that they must understand the full system of the body to become a doctor. It's not to pass any kind of competitive exam.
So I want to add one more thing here, ma'am. In our university, what we do is, we must make our student to pass the licensing exam. That is
first.
Of course, first priority.
Yes.
But at the same time, we want to make doctors who have knowledge.
Yes.
Not only the doctors who can pass the licensing exam and they don't know how to practice. We don't want that type of doctors from Asia International University. We want those products who can practice as a good doctor as well.
Yes. And sir, one more thing is that what about the hours you are studying for physiology and pharmacology? How many hours you are giving? Like how many hours the university is having for these two subjects?
Exactly, ma'am. For physiology, we have separated 3 semesters. 3 full semesters we have given for pharmacology, and physiology also full 3 semesters. So physiology will teach in first semester, second semester and third semester, and then pharmacology we start, ma'am, from third semester, fourth semester, and we give a bit of break and we complete it in 9th semester. Okay.
Okay.
So 1 year continuous teaching and a little bit of clinical type of teaching, and then a little bit of like antibiotics and those type of things in 9th semester. We have
That's a little
arranged
bit
like
hard.
this. Yeah.
Sir, by chance, I'm asking if any students is failing in one subject.
Yeah.
So what is the next step? Like how that he will be failing in the next subject, or he has to complete again? He has to revive the last semester, or he can
So,
skip?
ma'am, it is like this. Once some student fail in one subject, so what we'll do is we want to retake the exam again.
Okay.
So we'll after few days we'll arrange his exam once again. Okay. And if he fails there also, we'll give one more chance.
Second chance.
Yeah. But he has to pay a little bit of fine according to the university rule. It is not that high. So
For the next retake.
exactly, we will continuous, ma'am. It's like that. So before the student goes for the summer vacation at home, every student must complete his subject. So we don't leave it. The student just like
Till
that.
the time he's
Exactly.
passing. So
Yeah.
it is very hard to fail in this university also. So you have to pass, and they will make you pass till the time you're not passing.
Exactly.
They'll not let you
Exactly.
fail. So this is one advantage, that many of the universities, many colleges, they're failing and then they're dropping 1 year. So there is a mess,
Yeah.
and they drop, they get 1 year black. So this
Exactly.
is not possible
Yeah.
in university. And sir, what about the questions? It's all the same, right? MCQ and all.
Yeah. So we take the exam in two different way, ma'am. One is called midterm exam.
Yes.
Yeah. We give 30% exam or take 30% exam in midterm as Viva.
Yes.
Yeah.
I just
Oral exam. Then 70% we take MCQ exam, and those MCQ are high standard MCQ. We take questions from previous FMGE exams. From first year itself, we are doing that. For example, in
Yes, I
physiology,
just have.
I take that physiology questions which were asked in FMG, anatomy, biochemistry, all those, and our students are doing it. So we are teaching in such a way that they are confident in solving those questions from first year itself.
Yes.
Yeah.
So from day one, it has been exercising every day.
Exactly. Yeah.
Oh, and what about the internship? When it is in the time of internship, what the students are going to the hospital? If
Yes, ma'am. After 5 year of complete, study, after they complete the 5 year, then last year, when 6th year is completely for internship. It will be a rotational internship.
in which subject will be covered?
Yeah, in
Is that
internal
right?
medicine, general surgery, obstetrics and gynecology, pediatrics, ophthalmology, ENT, emergency medicine, anesthesiology. Most of the subjects will
And how
cover.
many hours minimum to minimum they have to give?
Ma'am, yeah.
According to MCI guidelines
Exactly, according to the MCI guidelines.
and
ma'am.
USMLE guidelines.
Exactly.
Like USA guidelines.
Exactly.
So they have to follow.
Yeah, they have to
Well-
follow. All the plan is already there. It will be 52 weeks of rotational internship. So all the subjects will be covered.
Okay. So, sir, one more thing I want to ask. Generally, I think in USMD there will be 27 OSCE stations. If I am not wrong, 27 OSCE stations, right? And for next, we are not aware of how many stations, because
Yeah.
in FMG there is no OSCE.
Absolutely.
So next we are expecting there will be OSCE exam. So it generally from first year, Asia International is giving the OSCE
Exactly.
preparation.
So, yeah.
How many stations you are covering?
Yes, ma'am. So that also I want to highlight a little bit. We are starting OSPI, means the basic science subject we call it OSPI,
OSPI.
and clinical we call it OSCE.
Yes.
We have started, or we are starting right from the first semester. Means we are incorporating this during the midterm exam especially. So like this, if there is a 30 marks exam, I am giving 15 marks for the OSPI or OSCE, and probably I'll make 5 stations.
For OSPI?
They'll rotate around, ma'am.
Yeah.
They'll rotate around. Like I'll set 5 stations, and I'll for example take the 5 or 6 students here. One will be rest station. They'll rotate around, and like that we are taking the exam right from the first semester.
But sir, I have one question. Like
Yeah.
from third year, we get the surgery on all the clinical things.
Exactly.
So from there, we start the OSCE. Generally, we
Yeah.
are going for gynecology
Yeah,
department,
yeah.
or what we have to do, we don't.
Yes, yes.
But what about the first year and second year student? How they are reacting? Like what stations they have been given to for
Of course, for example, I'll give you an example. Like in anatomy, like sir is teaching bone these days, right? So one of the bone will be selected as one station.
Okay.
You know that?
Okay, like that. Okay.
Yeah, exactly. One organ is selected and we point. Okay, what is this specific area in this organ? Identify and write the functions of this. That type of station.
That type of stations. Okay, that is known as OSPI.
OSPI. Yeah.
Okay, and from third year it is
OSCE.
Okay, okay.
Exactly.
So till fifth year we have OSCE.
Yeah.
They will be teaching OSCE. I mean all the stations, and in the internship they will have the
Rotational.
plus classes will be there.
Yeah, classes will be taken in the hospital itself. There will not be separate lecture or practical classes. It will be like pure clinical type of teaching, ma'am. According to the patient case, we'll explain the case. We'll explain there. It will be rotational type of.
Sir, how many OSCE stations they have to pass minimum?
No, that is not. We like, for example, it will be according to the situation, ma'am. For example, if there is a 15 marks, if it is a 3 marks OSCE, also I can set 4, 5. It depends on the situation. Yeah.
Okay, so it is the mid marking is also there. Is somebody's washing the hand, or if
of course, washing the hand can be a separate OSCE station.
Yeah. Oh, okay.
You know that.
Okay.
So how the students are washing the hand, we can judge. We can give marks from there also.
Talking to the patients and all. Okay. Oh, that is from the beginning only you're teaching.
Yes.
That's great. That it's generally in other universities the end of the year, like in 4th and 5th year they're doing, and it's an advantage that here you're starting from the beginning and you understand how it goes. Because once you're entering into 5th year or 4th year, you don't understand what to do. And you get negative marking or less mark on that. But here,
we are training them from very beginning.
From day one.
Very beginning.
And so that's great. And sir, how about the students? They are very good.
Yeah, our students are very disciplined, good, and a type of family environment we are providing, ma'am. Like our madams are also here. They take care of our female or girl student, and if they have any health issues, they'll approach us first.
Okay.
They call us, they tell us, and we'll guide them where to go, what to take.
That means it's very friendly.
Very friendly. If they have any problem, they don't hesitate to come to us. They are not afraid of the professors, They are like very friendly.
Very friendly.
So that type of environment we are maintaining.
Very, very nice. It was great talking to you, sir, because you have been giving doctors a lot of progress to our country, and it was nice talking. Thank you for your time so much, sir. Thank you so much, sir.
Yeah.
Thank you, sir.